Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Introduction. In the realm of beverages, the combination of caffeine and alcohol represents a perplexing juxtaposition of stimulants and depressants. Despite their widespread consumption in social settings, the simultaneous intake of these contrasting substances has raised concerns about their potential synergistic effects on health and well-being. This comprehensive exploration delves into the physiological mechanisms underpinning the incompatibility of caffeine and alcohol, unraveling the intricate interplay between stimulatory and depressive forces within the body and the implications for overall health. Conflicting pharmacological effects. At the heart of the discord between caffeine and alcohol lies a fundamental clash in their pharmacological effects on the central nervous system. Caffeine, a potent stimulant, exerts its effects by antagonizing adenosine receptors in the brain, thereby enhancing alertness and arousal. In contrast, alcohol, a depressant, acts upon gamma-aminobutyric acid, GABA receptors, dampening neuronal activity and inducing sedation. When these disparate substances converge within the body, they set the stage for a biochemical conundrum characterized by conflicting neurochemical signaling pathways. Impact on cognitive function. The consequences of combining caffeine and alcohol extend beyond mere physiological interactions, permeating into the realm of cognitive function and mental acuity. Caffeine, with its stimulatory effects, may mask the sedative effects of alcohol, leading individuals to underestimate their level of intoxication. This phenomenon, known as wide-awake drunkenness, can impair judgment and decision-making, increasing the risk of engaging in risky behaviors or making poor choices. Metabolic considerations. The metabolic fate of caffeine and alcohol within the body further underscores their incompatible pairing and potential health implications. Caffeine, as a xanthine alkaloid, undergoes hepatic metabolism primarily via cytochrome P450 enzymes, yielding metabolites with varying pharmacological activity. Conversely, alcohol is metabolized predominantly by alcohol dehydrogenase and aldehyde dehydrogenase enzymes, culminating in the production of acetaldehyde and acetate. The concurrent metabolism of caffeine and alcohol may overwhelm hepatic detoxification pathways, leading to the accumulation of toxic metabolites and metabolic stress. Cardiovascular effects. The cardiovascular effects of combining caffeine and alcohol warrant scrutiny due to their potential impact on heart health and hemodynamic stability. Caffeine, with its vasoconstrictive properties, can elevate blood pressure and heart rate, exacerbating the cardiovascular strain induced by alcohol consumption. Moreover, the diuretic effects of caffeine may potentiate dehydration, further compromising cardiovascular function and increasing the risk of adverse cardiac events. Gastrointestinal disturbances. The gastrointestinal tract serves as a battleground for the conflicting actions of caffeine and alcohol, giving rise to a myriad of digestive disturbances and discomfort. Caffeine, as a gastric irritant, may exacerbate the gastrointestinal distress commonly associated with alcohol consumption, including nausea, vomiting, and gastric reflux. Furthermore, the combination of caffeine and alcohol may disrupt gastric motility and gastric emptying, prolonging the duration of alcohol absorption and exacerbating gastrointestinal symptoms. Neurotransmitter modulation. The modulation of neurotransmitter systems by caffeine and alcohol underscores their intricate interplay within the central nervous system. Caffeine, through its antagonism of adenosine receptors, increases the release of neurotransmitters such as dopamine and norepinephrine, contributing to its stimulatory effects. Conversely, alcohol potentiates the inhibitory actions of gamma-aminobutyric acid, GABA, leading to sedation and relaxation. The simultaneous consumption of caffeine and alcohol may disrupt the delicate balance of neurotransmitter signaling, contributing to neurochemical dysregulation and potential mood disturbances. Psychological implications. The psychological implications of combining caffeine and alcohol extend beyond the realm of physiological interactions, encompassing mood modulation and affective states. Caffeine, with its stimulatory effects, may temporarily alleviate feelings of fatigue and lethargy induced by alcohol consumption, leading individuals to perceive themselves as less intoxicated than they actually are. This discrepancy between subjective perceptions and objective intoxication levels may contribute to increased alcohol consumption and impaired decision-making, heightening the risk of alcohol-related harm. Behavioral consequences. The behavioral consequences of combining caffeine and alcohol are multifaceted, encompassing a spectrum of outcomes ranging from heightened arousal to impaired judgment and coordination. Caffeine, by attenuating the sedative effects of alcohol, may prolong the duration of social engagement and delay the onset of alcohol-induced impairment. However, this masking effect may lead individuals to underestimate their level of intoxication and engage in risky behaviors such as driving under the influence or engaging in unsafe sexual practices. Clinical implications and public health considerations. The clinical implications of combining caffeine and alcohol underscore the need for heightened awareness and preventive measures to mitigate the potential risks associated with this dietary pairing. Healthcare providers play a pivotal role in educating patients about the adverse effects of combining caffeine and alcohol and counseling them on harm reduction strategies. Furthermore, public health initiatives aimed at raising awareness about the dangers of this combination and promoting responsible drinking habits are essential for safeguarding community well-being and reducing the burden of alcohol-related harm. Conclusion. In conclusion, the combination of caffeine and alcohol represents a complex interplay of stimulatory and depressive forces within the body, with far-reaching implications for health and well-being. Through a comprehensive examination of their pharmacological effects, metabolic considerations, and physiological interactions, we elucidate the intricate dynamics underlying their incompatible pairing and the potential risks associated with concurrent consumption. Armed with this understanding, individuals can make informed decisions about their dietary choices and adopt harm reduction strategies to promote optimal health and well-being.